Hello friends, I am Dr Ankit Parakh. I work as a consultant in pediatric pulmonology, allergy and sleep medicine at Children's Chest Clinic, New Delhi. Wheezing is a very common problem which we see in children. And the most common cause of wheezing which is found in children is asthma. But all that wheezes is not asthma, which means that there can be causes of wheezing apart from asthma. Now, because asthma is the commonest cause of wheezing in children, all wheezing is thought to be because of asthma, which is not correct. So let's understand what can be the other causes of wheezing besides asthma. The other causes of wheezing could be a foreign body in the airway. This is especially seen in young children. They can aspirate a nut like a peanut, almond, cashew, but they can aspirate anything else, small parts of a toy. They can aspirate things like sharp objects, nails, etc. So that is one cause. The other causes could be that there can be a compression on the airways because of blood vessels around the airway. The airways of children can be naturally floppy, which is called as a tracheomalacia or a bronchomalacia. Some children have more mucus in their airways because of a condition which is known as cystic fibrosis. The other causes of wheezing could be things like a gastroesophageal reflux disease, where the acid from the tummy comes up to the food pipe and goes to the lungs and irritates the lungs. In addition to this, there could be other causes of wheezing like infections, like a tropical pulmonary eosinophilia and allergic bronchopulmonary aspergillosis. Now, are there any clinical clues which can help us understand that wheezing in a particular child may not be because of asthma? Yes, there are clinical clues or signs which we call as red flag signs. Now, if these red flag signs are there, we have to be very cautious and think about alternate diagnosis, as this might not be asthma. What are these signs? If we have wheezing in children who are very young, so children less than 6 months of age, if they have repeated episodes of wheezing, especially if it is severe and require hospital admissions, is usually not because of asthma. Children who have a poor weight gain and a poor height gain is usually not because of asthma. Children who have persistently wet cough or cough with sputum or phlegm is unlikely to be asthma, and the more likely diagnosis would be a bronchiectasis or a cystic fibrosis. Children who have a persistent noise from their airways, a whistling sort of a noise from their airways, or a harsh noise called as stridor is usually not because of asthma. So these are the few clinical signs which tells us that this disease may not be asthma and we might be dealing with something else. Now, in addition to this, if a child seems to be having asthma but doesn't seem to respond to the treatment which other children would, this again might be a clinical sign which suggests us that it might be some other diagnosis. Now, what are the investigations we require in children where we think that there can be other diagnoses apart from asthma? Well, there are lots of investigations which might be needed, and they need to be tailored to a particular child. These investigations are usually one in the form of a lung function test, which might be spirometries in older children or oscillometries, which we do for younger children. Now, in addition to this, radiological investigations like X-rays or CT scans might be required. Children might require airway examination in the form of a bronchoscopy to look at the problems inside the airways or take out foreign bodies. Children might require scan to look at gastroesophageal reflux, and children might require a sweat chloride testing to pick up cystic fibrosis. So if your child is having wheezing and is having any of the red flag signs which we have talked about, your child needs to be seen by a pediatric pulmonologist to ascertain what is the diagnosis and what is the correct treatment. So for more information, you can log on to our website ankitparakh.com.